Hello, and welcome to ASCA's online clinical and operational benchmarking survey instructional overview and demonstration. Here are some comments from recent survey participants about the benchmarking portal. They found it simple to use, easy, and very intuitive. This Getting Started video focuses on accessing the online survey, the platform's overview and navigation, how to enter your ASC data and review your results, and downloading your reports. The Clinical Operations Survey is a secure, easy-to-use web-based benchmarking platform. The online survey will open at the end of each calendar quarter for data collection, and reports will be available the following month, according to this schedule. For example, first quarter data entry will be open from April 1st through April 30th for subscribers to log into the platform and enter their first quarter data. Access to the results for that first quarter will become available in mid-May. Your subscription to the benchmarking platform includes access to enter your data and download dynamic online reports and results. Once data collection closes, access to those results will become available on or around the 15th of the following month. Results are available in PowerPoint slide decks and Microsoft Word formats, and the platform allows users to compare their results to their peers using the platform's dynamic filtering system. We encourage you to log in and get started today. Subscribers will log in directly from ASCA's website using your existing username and password. Users may log in and out as often as you like. Data entry will be available during the data entry period, and you can log in and out over multiple sessions during that time. You don't need to complete the survey all in one sitting. Access to the platform is available 24/7, making it available and convenient to fit your schedule. For demonstration purposes today, we will log in using one of our tests. Once logged into the platform, users are presented with a welcome message. Be sure to review the message each time you log in, as it will be updated to communicate data collection deadlines and/or announce the release of survey results. In this window, users can download a copy of the Quick Start Guide. This PDF document will answer many of your how-to questions regarding the platform's navigation and features. Users can also download the help document. This PDF provides full help documentation with links for all questions in the survey, and this document can be downloaded and saved to your desktop or printed out for future reference. After reading and downloading these documents, click the Get Started button or the X to enter the survey portal. We are now on the survey homepage or the main menu. On the top right-hand side, you will see your username and a link to the support page and a link to log out. In the upper left-hand side of the page, you will see a current account indicator. If you are responsible for entering data for multiple ASC facilities, all of those facilities will be listed in the drop-down. Using the drop-down menu, you can select the account you wish to work in. This makes it easier for you to switch between accounts to enter data and view results. There's no need to log in and out into multiple accounts. As a general rule, for users that are responsible for multiple facilities, always make sure that you are in the correct account before entering or updating any data. For users that only have access to one ASC facility, you will not see this current account or a drop-down at the top of the screen. Let's take a quick look at the support page. Here you will find a basic overview of the platform's features, as well as a list of resources to help you complete the survey. The list of survey questions The Quick Start Guide and the help document are also available on the support page for download. Now we'll click on the home page to return to the main menu. On this tab, we are going to enter our data. This is where you would step through the survey and enter your ASC's data. The Run Reports tab is where users can download a variety of dynamically generated Microsoft Word and PowerPoint slide decks when reports are available after the data collection period. On the main menu, you will see that questions are divided into sections, and each section contains bulleted subcategories with questions. At the bottom of the home page, you will see a progress graph. This graph tells you how much of the survey questions you have completed each quarter. Right now, there's only one quarter available, but over time, there will be multiple quarters listed in the progress report. The blue bar would indicate that that is the active quarter. At any time, if you wish to change quarters, just click on one of the other gray bars that will be available to activate a different quarter. Question tallies appear at the bottom of each question group and let you know how many questions you've answered for that particular section. This way, if you exit the survey and then log back in to answer or enter more data, you'll know where you left off. Please note that you may not be able to answer all questions in the survey, and that's okay. Some questions just may not apply to your facility. It may be a question that doesn't relate to a service that you offer. The important note is to answer as many questions that apply to you as accurately as possible each quarter to ensure that your personalized reports and survey results are accurate and meaningful. To begin entering data, simply click on any of the bulleted gray question groups to get started. It's not necessary to start in a specific place or proceed in a specific order. You can log in and out as often as you like during the data collection period and enter your data. This survey collects demographic information annually and key clinical benchmarking operations data quarterly related to volume, quality, operations, outcomes, complications, staffing, and financials. The survey uses the latest encryption technology to ensure anonymity of our participants and the security of your data. Please rest assured that your data will not be accessible to other participants, and all survey results are presented in the aggregate. Let's get started by entering some basic profile information about your ASC by clicking on the Profile and Demographics question group. Note that these questions are annual questions. They do not have to be answered every quarter, but they can be updated during the year when data collection is open if you do have a change to some information that is in the profile section. It's important to answer all of the questions in this section as they are used for key filtering and demographic information regarding our survey population. Here you will notice that sections are divided into short, easy to answer question groups. These questions can be asked in several different formats. On this page, you'll notice that every question is noted with the arrows, and the text underneath the question is in blue. We call that help text. You'll see the help text throughout the survey platform, and that provides additional clarification and definition as to what type of information should be included in your response. There are multiple choice pull-down options, answer options on this page. There are also some check all answer options for multiple choice questions and the select one answer options. We're going to go ahead and complete a couple of questions that haven't been answered on this page. So for my years in operation, my answer options are a range. So my center's been in business for 5 years, so I'm going to select 4 to 6 years. You'll notice that the entry field turns green, indicating I have new data. We'll take a look at the size. My center has about 10,000 square feet, so I'm going to make that selection. And the accounting method, I had to check with my accounting team, and we use a cash basis for our accounting. So I'm going to scroll to the bottom of the page, and this is really important. At the bottom of each page, you have several options of how to save your data to the database. You can save this page, which will save the answers, the new answers in green, to the database. You can hit cancel to clear out those answers that are in green and start over. Or you can click the Save and Continue button, which will save the answers on this page and return you to the main menu to begin another section of the survey. So I'm going to save this page. And you'll notice that my entries, my 4 to 6 years, and my square feet have been saved to the database. They've turned back to white, indicating that the data has been saved. Let's return back to the main menu and take a look at some of the quarterly questions. In section 1, volume measures, we're going to take a look at that section because that's a really key section for this survey. One of the most important questions each quarter is your total patient encounters or cases that occurred during the quarter. This data that is entered is used throughout the survey to calculate your results in several key areas and is used to indicate rate of occurrences, and a lot of those are based on your total patient encounters. In this section of the survey, you'll see that we have more numeric answer options. So users can just enter the actual number. There's no need to add commas, and we do request that you enter your data in whole numbers without decimal points unless otherwise noted. So certainly enter your data, and once you hit the Save button at the bottom of the page, commas will be added or percentages will be displayed if appropriate. You do not need to add any of those characters when you're entering your data. As mentioned, back on the home page, there are several sections to the survey each quarter. And once you've entered all of the data applicable to your center in sections 1 through 7, you're able to view your results immediately by clicking the Review My Data section and the My Results Summary. On this tab, based on the data that you'd entered, you will see the results for your ASC have been automatically calculated and are displayed on this page. Users should use this screen to review your results in each key area and each key benchmark to check your work to verify that the information that you've entered in each survey section was entered correctly and that these calculations appear accurate. If a reported value appears incorrect, simply go back to the section to verify the data you entered is correct. And make sure you hit the Save button to update your changes in that section. If there's no value for a calculation or a question on this page, this means that you did not answer the question because the question either didn't apply to your services provided at your ASC, or you may not have completed the entire survey yet. This results page provides users with the calculations used to compute each result and also provides some key information as to how an ASC might use each measurement to improve or track their center's performance. In addition to your individual performance results, when full survey results are released quarterly, users can click on the Run Reports tab to view the survey results by quarter when available. On this tab, users are able to run reports that will display aggregate results from all survey participants. If you want to drill down into the data, you can select filters and filter survey results for more meaningful comparisons. For example, if your center specialty is ophthalmology, you can apply a specialty filter specific to single practice ophthalmology centers. And this allows you to actually the data in the aggregate for ophthalmology centers specifically. And what this does is this allows you to see how you compare um, to other centers that are specific to your industry and produces more meaningful filtered results. One of the reports that users will have access to is the Clinical and Operations Report Card. And here is a sample copy of that report. It is a Word report, and it can be filtered based on the filters available, and that's specialty and area of service. And it provides a nice overview of all of the performance measures in the survey. And it provides you with the actual measurement. It provides you your center's answer or ratio, and it also provides you the median result for all survey participants, and that might be a filtered subset, or it may be the full survey database. And this report can be downloaded and printed. The other key report that we provide is a profile and demographics report, and this is a PowerPoint slide deck. And this provides key information relative to the survey participation, as far as the type of specialties that they are represented, the number of operating rooms, a lot of key demographic information, certifications, location, and also can be downloaded and saved and shared with others in your organization. As mentioned, once the data collection period has ended, access to your quarterly reports and results will become available in the platform and can be downloaded on the Run Reports tab. You will be notified by email when the quarterly reports are available for download. These Microsoft Word and PowerPoint reports provide quarterly results on how your ASC is doing compared to your peers and will display aggregate performance data to include your responses as compared to the median. Results can be filtered by specialty, service area, ASC ownership, and total encounters to drill down into the data for more meaningful comparisons and benchmarking. This concludes our demonstration of ASCA's Clinical and Operational Survey. If you have questions, be sure to visit the support page for additional resources and information, or contact the ASCA support team at asc@ascassociation.org. Thank you.